Hi, I'm Dr. Sherman Canapp.
And I'm Dr. Debra Canapp.
And we're with the Veterinary Orthopedic and Sports Medicine Group, or VOSM, and we're going to be talking about light pads as a way of thinking about preconditioning and recovery. Deb, why don't you tell us a little bit about photobiomodulation or light, or these light pads? Essentially, how do they work?
Yeah, I think we spent a little short period of time on that, but basically, we know that light therapy reduces tissue inflammation, it increases blood supply, it reduces degeneration and cell death, so it kind of removes waste products out of the area. Ultimately, it aids in tissue repair, or making those cells kind of be the best that they can be. It also promotes collagen in repairing tissue also. So we know the basis of light therapy and photobiomodulation gives all these great things to cells.
All right. And what's exciting about these is that we've known for years how light works and the positive effects on light on tissues. And now it seems like there's a product, a device we'll call it, that's come from the human field, because a lot of the data started in humans and human athletes in particular. And it seems like it's now available for canines,
yes,
for in the veterinary space, and what's incredible is the technology. People question, what is light? How could it actually work? How does it have enough power? But this product is really impressive. You want to tell us a little bit about the stats on the product, or some of the design modifications?
So again, for years, our clients have always asked us, what is a light therapy product that we could use at home? What's a reputable and what's the one that you like? And for years, the stuff out there just wasn't up to our standards, right? And so finally, we have found a pad that we kind of, again, not using for treatment of injury, but using for conditioning and recovery, which is really the new exciting area of light therapy. And so this pad actually has, it's battery operated, so it's great, easy for use. There's there you go. There's no cords or anything like that, so it's great to use on your canine athlete or even your companion. The total power outage of that for a 20-minute session is 600 milliwatts.
Wow.
Which is awesome, which is way awesome. The wavelength is about 850, I believe, yeah. And then it delivers about 5 to 6 joules per centimeter squared. So with the size of the little nubbins there and where that's distributed, the total dosage is about 800 joules or so. So per
that's
area
really
that you
powerful.
treat. Yeah, that's wonderful.
And then you have, with this being this size, you have a larger surface area for the larger muscle groups or larger areas that you may be treating.
And that's what we'd like to target when we're preconditioning and post-recovery. So trying to get those muscles feeling better after work.
That's fantastic. And how does it work as far as charging it?
So there's a USB cable that just plugs right
there.
in. Yeah, there. And then you just charge it after the battery runs down.
And it tells you that. I think these little lights, is that how it works? It gives you an indicator. Perfect.
Yeah.
So light pad indications, so in other words, what are we thinking about? So we have this device that's now been developed, and really the way they've modified it from human sports medicine and using in human athletes and human patients to the canine is that we don't have fur. We don't have fur, and so with the device that's available for humans, it goes flat to their skin. But with dogs, especially border collies, we're talking about the use of this for canine athletes and sporting dogs. A lot of these are German Shepherds. They are border collies. They're Aussies. Thicker coats, Dobermans that don't have thick coats. But I think that's the idea of these. What we call them the nubbins. But there's a more medical term for these that we'll discuss later. This actually allows you to get down into the fur, into the coat, so you have direct surface contact. And what do we know about light on the tissues? Meaning, what's it do for energy? What's it do for ATP? How does this? If I apply this to a certain area, on Egret, she's asleep right now. But if I was to say, listen, sporting dogs, we know the shoulder, one of the most common issues, in the back end, iliopsoas, your QLs, quads, hamstrings, sartorius, being an issue in the back end. So if I was to actually take Egret, which she loves when we do this, and actually just apply this to her shoulder, the light goes through this mechanism to the tissues, and then what happens?
Right, yeah. So it basically increases blood flow to the area that you're treating. It helps to increase ATP within the cells, and so it gives the cells extra energy. If you use it, say, on an older patient, it helps those cells kind of be the best that they can be. And so, as you get older, you kind of age a little bit, so do your cells, but it helps you to kind of not rejuvenate them, but to give them the best possibility of energy and waste product removal.
So it allows for optimal performance. So basically it helps to jumpstart, if you would, the tissues to prepare themselves for sport or for action, essentially. Okay, that makes sense. So if we're talking about preconditions, so the whole idea here is we're looking at dogs that may be doing work, whether they're a sporting dog, agility, fly ball, dock diving, so many different sports that dogs perform in. They could be a canine companion and they're about to go for a long hike with the owner or go for a jog or a climb up a mountain, or it could be a working dog, police dog, search and rescue dog. If they're going to use this prior to those activities, at least based in the human literature, they call that preconditioning. So you're going to apply this before. And I guess the idea is it just helps to loosen up the tissues. All of us listening to this, there are certain areas of our body that are tight. It could be our hamstrings, it could be our psoas, it could be our rotator cuff. So the idea is to apply this prior to your training, prior to your work, prior to just being active, and that's really going to help bring in blood supply and loosen up the tissues. And it's especially, I think, important for areas of previous injury or concern. So you may be seeing a veterinary rehab therapist or your veterinarian or anyone that's having any kind of body work done and say, you know what, this is one particular area that we've injured before, or it's an area that's always tight. I think that it's really important to potentially treat or apply this to that area. Would you agree?
I completely agree, yeah.
Okay. So the whole idea is to really improve or complement or increase the warm-up, as a warm-up type device, I guess we would call it.
Yeah, that's where most of the current data is at.
So we would call it basically improved or complete warm-up because, is warm-up still important? This isn't replacing warm-up. This is just another way to add and to really further added, have an added
kind of
effect.
focus treatment to those big muscle groups that we know are going to work really, really hard during their run or during their work or training. Yeah.
Okay, that makes sense. You've applied this before, so you're going to go ahead, you're an agility dog, flyball dog, search and rescue dog, or you're a canine companion, you're about to go on a long hike with your owner. They've applied this, they've done appropriate warm-ups, they've used the device. Now they're coming back in after their 3-hour hike, or they're coming back in after their session. That's called recovery. So based on the human literature, this is now being applied, and this is for recovery. Tell us a little bit about that.
Yeah. So basically it's going to help decrease inflammation by removing those waste products, say decrease lactic acid, increase blood flow again to those areas that have worked. So to help that waste product removal in order to get that stuff out of those muscles to make them recover in a more complete fashion.
Okay. And again, complete fashion meaning that this doesn't negate the need for
cooling down,
appropriate stretching, and so forth. This is added into that regimen just to make it more effective, more complete.
Absolutely.
Okay, that makes sense as well. So I'm a board certified ACVS surgeon and boarded in sports medicine. You're boarded in sports medicine, and for us, it's really important that if we're going to recommend a product, a device, any type of anything, supplements, surgical treatments, rehab treatments, that there's data behind it. Okay, I think that's really important.
Very important
and I've never used something on my patient that I wouldn't use on myself, and therefore I really kind of dig deep into data. There's a lot of data out there on these. And it's been around for years. The first report that I was able to come across in PubMed, and you can easily find these at home, Google Scholar, just Google them, was actually in 2016. And there's a paper. A lot of these were in mainly in human athletes, because again, this is the whole idea of using this as preconditioning and post-recovery.
The research goes back as far as like the 1990s.
1990s.
Yep.
I didn't dig deep enough.
No.
Wow. And what did they find?
Yeah, it's all about, again, they started in rat studies and stuff like that, but they found that with light therapy, trying to figure out the dosage, when to do it, that they actually saw, faster recovery times, more ability to go longer and go stronger. So they found a lot of great data.
And I pulled a few just so we could share with the people watching. And we're going to scroll into these papers, and you'll be able to see them. But I'm just going to read off some of the findings. It's quite impressive. So this was a study out of 2016. It was in rugby players, and this was a randomized crossover, double-blinded, placebo-controlled study. So prospective, and so this is pretty high-end evidence. What they found was there was significantly improved average time in sprints and fatigue index, significantly decreased percentage and change in blood lactate levels. So they looked at not only performance, they looked at biochemical profiles as well, and enhanced performance and accelerated recovery and high-level athletes. So they not only looked at function, they looked at biology as well, and it was
a great paper that
statistically
takes performance and recovery into one. So they actually watched both instead of just saying, "Oh, hey, it's going to help performance or it's going to help recovery." So
so data that shows use it before and use it after. Let's look at a few more papers. So here's another one. Again, this is 2016. Five photobiomodulation and human muscle tissue, an advantage in sports performance. And this one, once again, peer-reviewed paper, that they showed an increase in muscle mass gained after training and decreased inflammation and what we call oxidative stress in the muscles. And these were based on biopsies. These poor athletes, they were willing to undergo biopsies. They must have been college kids. But basically, less inflammation and improved performance, once again, from light.
Yep.
Yeah, let's look at just a few more, because I find this fascinating. 2016, pre-exercise, low level, and skeletal muscle performance. So what they found, once again, pre-exercise, mainly in here they use 50 joules, significantly increased performance and improved biochemical markers related to skeletal muscle damage and inflammation. So once again, by using this device, you're helping with inflammation and tissue function.
Normal inflammation that happens after working out or after conditioning and stuff like that. So, not inflammation from disease or things like that, but your normal stuff, that your everyday, training episodes.
Right, no, that makes sense. Few recent papers, and I won't go into great detail, just you can find these on your own, but this is a 2018 paper, two of them. Photobiomodulation therapy, improvement of muscular performance and reduction of muscular fatigue. And then another one, photobiomodulation therapy mitigates effects of exercise-induced skeletal muscle fatigue. Okay, so once again, it keeps pointing back to, this is going to help you with not only performance, increasing your performance, but also decreasing the negative effects of performance on your body.
A lot of the papers just show with treating certain big muscle groups in people and then walking, they can walk farther distances or do a repetitive action longer. And so again, it's all about increasing that cellular energy and helping that waste product removal so that way they can function the best that they can.
Yeah, and this paper is hot off the presses, and I was so impressed with this, A, the paper, but B, Dr. David Levine, so brilliant human physical therapist, physiotherapist, and also canine rehabber, certified in both. And he's one of the authors on this paper. This just came out, 2019. Muscular preconditioning using phototherapy improves physical work capacity of the quads when applied between repeated bouts of resistance exercise. So what do they mean by between?
Yeah, so it kind of just applies exactly to our canine athlete of if you have several runs a day or several activities that you have to do in a day, that you can actually treat in between them to help those muscles perform to the best that they can.
Okay, so it's okay, you treat before as you're doing your warm-up. As you come in from your training sessions or from competition, you actually apply again.
Yeah, you absolutely
and then when you're done at the end of the day, then you do it again.
Yeah, absolutely.
Based on the human papers.
Yeah, you absolutely can.
Wow, that's fascinating. Application and protocols. Walk us through, because I don't understand these things as far as, and you're the rehab queen. And so how's it work? As far as I want to apply it to Egrid if she ever wakes up, and walk us through that.
So there's a ton of data out there, and we're still trying to get the absolute, what exact time frame should you do before. There's papers, the earlier papers started 3 to 5 minutes before the activity, but they've actually kind of disproven that, and they want a further period of time away from the activity. So you can actually do it 20 to 60 minutes prior to the session, training, competition. You can actually repeat it again in between the sessions, and again, what we're estimating is at 20 minutes before the activity. So if you have, an hour and a half between activities, then again another 20 minutes or to 60 minutes before the next one.
That makes sense.
Repeat again. Then we're also talking about post-activity, and so that's not as specific. So you could, once your normal cool down, you're done training, you can go ahead and just do range of motion, stretch, and put the pads on. Or you can do it up to 6 hours later. That's kind of what we're coming up with. If you do it the next day and you're kind of doing recovery that day, that's fine too. So it's not like it has to be a more specific time after. But if you think about it, your muscles are going to recover within that next 6 hour period of time. If you kind of work out, soreness happens after that point in time. So we're saying about 6 hours.
So it's a 20-minute session, 20-minute treatment. So would it make sense then, because say we're doing shoulders, again, most of the dogs I'm seeing as patients from around the planet, forelimb is going to be the shoulder. Hind limb many times is the psoas, iliopsoas, or your QLs or your hamstrings. So it doesn't make sense then if you have to do 20 minutes on the shoulder, can you run 2 pads at one time so that you don't have to do
absolutely.
20 minutes and then you have to do 20 minutes? Could we just
Run
apply,
4 pads.
you know, to each side bilaterally to the shoulders, and then if the, you know, if you want to slide bilaterally to the psoas or the hind limbs, you could as well.
Exactly.
You can do both at one time.
Yep, or you can do all 4 areas at one time if you want to treat front and back.
Okay.
It just depends on how many pads you have.
So
But
you
yes,
would
could.
just do a Velcro strap that we're going to demonstrate in a little while around the front, slide both in, so that hits the shoulders. Say you're doing agility, we know shoulders and then potentially ilios. 2 running for the shoulders, 2 running for the ilios.
Right, and
okay.
or you can situate them if they're laying on the floor and they're pretty good at staying kind of in a down. You can situate one pad and hold the other, or so there's lots of different ways.
Okay,
that
different
you can
ways.
do it.
And again, we're going to take Egrid if we can get her to wake up and actually do a demo in a little bit of time to show you how to actually apply these to various locations in the body. So the slide I put up now, this is the website that you can find the EdgeLight therapy system. Right now, I'll give you a little history on this. I was introduced to this by a great friend and colleague who's a brilliant PhD engineering in these types of areas of engineering with light and lasers and so forth. And he showed this to me like a few years ago and showed it to you as well. I, being one of those people that's slow to adapt to these types of modalities, you said straight away, we should bring this to veterinary
Right, look at
medicine
all this
right away,
research in this area.
and all the
It's
research.
amazing.
But then I stumbled across and said, hey, you know what? There's this
Yeah.
light pad
I'm really
that's
excited
got
over
great
it.
data,
Yeah,
and then it was my idea, so it was okay. So I pushed and pushed for the last 2 years to begged and pleaded to get this into the veterinary sector, into our canine athletes and canine companions. And it's available. And they not only made it available, they modified it for
Yes,
canines
which is
specifically. So because I pushed and pushed and pushed, and was a little bit of a, thorn in the side trying to make this happen, which they were so grateful, I think, at the end of the day, and I'm so gracious and grateful to allow this to come out. They're doing a discount. So they're calling it the Canapp, Team Canapp here, Edge discount, if you would. So if you go to order online, there's a Canapp code. It's Canapp 10, I think. Canapp 10, and you're actually going to get a 10% discount off. And so for any of you that are watching this, if you do eventually go to place the order, put in the Canapp 10 code and you'll get a discount on these as well. So Deb, we've received great feedback so far on this device, and with that, a lot of really good questions, and
Great question.
some questions I had no clue. So luckily we have you here to answer these. I did some data digging as well and learned a ton. And I was impressed with this early on. Now I'm even more impressed with it. And I thought we'd go ahead and take some of these questions that you, the viewers, sent in to us. And some of them were very, very similar. So you're all asking very much the same questions. We consolidated those, condensed them, and we have some answers for you. So we're going to go ahead. We'll place the questions on the view box that you're going to be looking at, the slides.
Okay.
But let's walk through some of the most common ones, if that's
Sounds great.
okay.
Yeah.
All right. So the first one that was sent in is, should this be used as a preventative or treatment to injury?
And so the way that I see preventative is basically, you want to prepare your athlete and condition them to the best of their ability in order to have the highest, possibility of preventing an injury.
Okay.
So, does the actual pad prevent it? No. Injuries happen from, freak accidents and stuff like that. But you can use these pads to help condition your dog to have them in the best possible shape, so that way they can, do their sport the safest.
Okay.
So the other thing is that this is primarily for conditioning and recovery, and so that's where we're focusing this on that kind of new and great data that's coming out on light therapy.
That
for
makes sense.
recovery and conditioning.
Would we think that if we look canine specific or even sport specific, we could break it down even to, we know that the working shepherds, the Malinois, we know that they're predisposed to, say, gracilis myopathy.
Exactly, yeah.
So it's so important with these dogs that prior to going out doing search and rescue or any of their protection work or just canine work that they're doing, that maybe this, especially for the gracilis, the semitendinosus, semimembranosus, so they would do their appropriate warm-ups, apply this to that location, because we know in those canines, that's one of the most common things we see in the hind end.
Right. And we don't know if it will prevent that, but it's good cellular energy. It's giving it the condition to be the best cell and the best tissue it can be. And so if that may help from preventing that, then let's go ahead and try it.
It can't hurt, it can only help.
Exactly.
So,
Exactly.
okay, next question. Can the EdgeLight be used in conjunction with laser indoor magnetic therapy. I wasn't sure about this one. What do you think?
Absolutely. So again, the dosage on this is for a conditioning or recovery type of treatment.
Okay.
So if your dog does have an injury, and you're kind of coming back and you're still seeing your veterinarian for therapeutic treatments,
Sure.
Manual therapy, laser therapy in the office, you can still come home and use this on the bigger muscles as your dog's going for their walks, to help condition those muscles to kind of regain and get back to where they're supposed to be. So that's something that we can use in condition. Laser and light therapy are both complementary to magnetic field therapy. Even if your dog was getting TENS or therapeutic ultrasound as a treatment, you can use this in conjunction with that.
So it's sort of like the multimodal approach.
Yeah.
When we talk about supplements, you're using your glucosamines, your chondroitin sulfates, your ASUs, omega-3s. This is just another multimodal approach
to having the
sports
best athlete possible.
Right. Okay, that makes sense. Next question. Is this useful for chronic conditions like elbow dysplasia or elbow osteoarthritis?
Right. And basically, this type of technology increases blood flow to the areas that you put it on. So it increases blood flow, it reduces cellular waste, and helps to increase cellular energy to repair itself, to exercise. So would it hurt? No, not at all. Again, we rely to our veterinarians and the in-hospital treatments to therapeutically treat it. But again, it's going to increase blood flow, and if that makes an area feel better, then great, wonderful.
Okay.
But again, we're primarily kind of launching this with conditioning and recovery, kind of as a maintenance type of therapy to help your dog perform and live the best way possible.
That makes sense. And I was surprised. I was like, well, how are you going to put this on an elbow? Because we're talking about big muscle groups like muscles of the shoulder. I didn't realize it molds.
Yeah.
So the circuitry in here actually allows for it to mold to particular areas of the body. So if you're using it on the stifle, if you're using it on the elbow, if you're using it on the hock or the ankle, it actually molds around those areas really nicely. I was surprised. And so, another technology that we have is another multimodal approach to the treatment of arthritis. Excellent. Another question, this is a good one as well. Is it just for athletes?
No, absolutely not. So I pretend my dog is an athlete, but she's not. She does sleeping very well.
She is in her mind. Right now she's running the course, going through jumps and weaves.
No, she's just sleeping and ignoring you is what she's doing. So it can be a preventative tool for any dog, a companion, working dogs, athletes. Even if you're a companion dog, he's an athlete in the yard chasing after the squirrel.
Yeah.
So again, you might not be able to time it correctly, but hey, after the end of the day, can you use it for recovery?
Right.
Absolutely.
I mean, I can't tell you how many owners come in here with their canine companions, and they're doing rock climbing, hikes, they're swimming with their dogs, they're going out kayaking, they may be going along trails and they're riding their mountain bike and the dogs are off in the fields with them. So this is another application then. Before they get on their bike and they go off riding and the dog's going to come along, they would apply this to the body as well.
Absolutely.
Okay, that makes sense. What are the specifics? So, we have these, what I'm calling nubbins, and I think they have a real, true scientific name. But what are tell me a little bit about truly the device itself.
Yeah, so, basically the surface area of the treatment area is about 150 centimeters squared.
Okay.
So you get about 5 to 6 joules per centimeter square of the treatment area. And that basically it's a 850 nanometer of light range that's being provided by each of those nubbins. And then so the total power of it's about 600 milliwatts for the entire treatment area.
Okay.
Yeah.
So it's nice because if you think about some of the other light devices, they're focal, they're round, they're smaller.
Yeah.
So you're going over this area, but you're not getting a larger surface area. So with this one, you're really covering quite a bit of territory.
Yeah. And again, like you could, if you go into your veterinarian and they're doing a therapeutic treatment, and we need to treat the shoulder, right? So they're using their laser, and if it's a laser that you're kind of holding off, well then, you would treat here and you would have to treat here and here. This is great because again, as a focal treatment for those muscles, you're getting that nice wide area. Some people have handheld, lasers at home that they like to treat in the same way with their dog. But again, you would have to, treat here and then treat
so it's
here
like spot
and
treatments,
here.
basically.
Yeah, so this is great because you just lie it over those big muscle groups and you get that whole entire area and you get an effective dose through the one pad treatment.
Okay, and I think these are called light pipes.
I like
if remember.
nubbins better. I like
Nubbins,
I
or
like
we can
nubbins.
call them light pipes. So basically that then allows the light to go into a very focal region.
Right.
Is essentially
So
what's happening.
absolutely, and we'll kind of. I think there's a question about the difference between laser and light. So
We're going to get to that one.
Yeah.
How long should the pad be on the area? So we're treating egrets shoulders. We're about to go out and run a course. How long?
Yeah. So our recommendation is 20 minutes. So there are a 5, a 10, and a 20-minute setting on the light pad built in. Most of them, I think, are set for 20 minutes when they come out of the box. But the way to set them for different times is you just hold down the start button.
The one right here.
Yep. So once you hold that down, it says for 2 seconds to start it. If you held it down for longer, that kind of changes the duration of the treatment.
So
we are recommending 20 minutes for each treatment area. Again, those big muscle groups to treat those.
I got it. No, that's easy to use too. There's just a sort of on-off right here, and I'm just holding it
Yep.
down and it's lighting up.
Yep, exactly.
Okay,
Yeah.
excellent. Another question, this was a good one. What would be the timing for a competition activity? So, and would it be different for a timing of a competition activity or versus the companion going out hiking, or walk me through that?
I think, again, there's so much data out there, and there's so many different times. But what we've collected most of the data is anywhere from 20 to 60 minutes prior to the activity.
Okay.
So that can be hiking, that can be chasing the squirrel in the yard, or it could be training or competition. So that's what we're going with. There's, again, if you actually pull the literature off of PubMed, you'll get anywhere from 3 to 5 minutes to like up to 6 hours prior. So, again, from what we've gone through, I think we were picking 20 to 60 minutes.
Right, so a lot of owners and canine handlers, they'll have multiple dogs running multiple sessions. So essentially they would have their canine athlete out, they would do a treatment, they run that, canine comes back in, they would hit again, then go ahead, get their other one out, and just kind of, is that what you're is
I don't
that how you
think
see
that
this?
if you're looking at recovery, I don't think you have to treat them right after they're done with
Okay,
their
so we have
session.
some time.
Yeah,
Okay.
in my opinion, I think recovery is at the end of the day.
Okay.
But if you're treating in between sessions, so your dog goes out, runs, goes back in the kennel, you run another dog, and then you're going to treat that dog again before it goes out, it's
Right.
kind of recovery condition.
Yeah, that
right?
makes sense. Okay, so dual purpose.
Yeah.
Excellent. Next question. So, how many charges does the battery hold if I can use it, and can I use it all day long? I was wondering the same thing because right now it's flashing, and I'm like, oh boy,
Yeah, well,
it's
that's because it's on. So
Oh, I know. So I
you
should
don't want to look at it.
Oh yeah, don't look directly into it. So I've turned this on. How long is it going to last?
Yeah, so it's a 20-minute session, and there's
Okay.
8 20-minute sessions per charge.
Okay.
So now if you used a 10-minute session, you have a small dog, small area, then it would more of those. But so again, we have 8 20-minute sessions, and then you have to recharge. And so basically what you also want to do to prolong the battery life is that you want to wait till the charge goes all the way down,
Right.
and then recharge it. So don't keep
Like a
hooking
phone,
it up.
like your cell phone
yes,
or any
exactly.
other
Don't
device.
keep hooking it up in between your treatments, because that will actually run the battery life down.
Okay,
Yeah.
and I think what happens, this is flashing right now. You see, one flash less as we're tracking the
Yep,
battery,
yep,
right? So
you
you'll
can watch
know
the
when you're
battery.
getting pretty close.
Exactly.
So
Yep.
okay,
Exactly.
perfect. Another really good question. So how is this different from other technologies that are out there? And I get commonly asked that. Since this has come out now, people are like, well, how's this any different than, my class
They really
this
are.
or class
Right.
that or my laser pointer that I'm using, because I was confused about that as well.
So, I think the first step for that is to look at the different type of specifications that we're recommending.
Okay.
So basically you want to have a good nanometer of light range to get to these muscle groups, and that is in the infrared, so that's around 800. So it could be like 850, it could be
Right.
875, but you want it kind of in that range.
Okay.
The more shallow nanometers of light range, like 660, just go superficial. So they're not bad. They
Okay.
can, treat skin things and stuff
Right.
like that. But, that's the kind of light range that you want to do.
Okay.
You need to make sure that there's enough power generated by your device to drive that nanometer of light range to the depth that it has to go. Most of the class 2 and 3 lasers out there can do that.
Okay.
And the difference is time. So we know that with the power of the 600 milliwatts to get that 5 to 6 joules per centimeter squared in that
Right.
total dose, you need to run this for 20 minutes. And so
Okay.
it's set properly to do that. The problem is that, if you went and got a laser pointer, and had light therapy that way, you would have to hold it for a very long time.
Probably
It's
like the whole day.
because it's a very low power.
Okay.
So these devices all kind of share the same technology. You have to just make sure that this is the time that you want to put into it.
Right.
So the lower powers, you're just going to have to hold it there for a much, much longer period of time to get the same dosage. After that, you have to look at a reputable company and what people back behind it, because unfortunately there's a lot of companies out there that try to mislead people. And I deal with it on a daily basis, and it's kind of sad, but they are. So you want to have a reputable company, people you can ask questions, that the data's there, and really look at the specifications that they all match up.
Right. And I know this comes from the background of a human company that has years and years and years of experience working with human athletes and very high-end technical equipment. And so, again, we don't put our name, we have this Canapp approved products, and we don't put our name on things that we, again, wouldn't use for ourselves or our own patients. And really, really impressive group that created this.
Absolutely.
Next question.
So this is actually a little extension of the other one. So a lot of people always ask me, what's the difference between laser and light therapy? Light therapy being LEDs. And basically the difference is that laser is culminated. So it's basically focused to a pinpoint. And what's really, really neat, way back in my career, there's camps out there that say that the focus light is better than the LEDs. And basically if you take a laser pointer to your finger, and once it hits that first cell, it disperses. So it looks like an LED.
It's sort of why you can hold it up and see it through your finger, right? Even a laser pointer.
Right. So once that focus light enters any tissue, it actually disperses. So it's exactly like LED light at the point. So that's the major difference between the two. So a lot of the research out there is really with LED or laser, and really there's, again, there's many different opinions out there. The power behind it is more specific. So there's a lot more data nowadays coming into what the importance of power is, and that's why you're looking at your class 4s for treatment areas. But what we have taken from the research is that, 600 milliwatts of power with this type of nanometer of light range will give you that treatment that the research has shown to be.
That makes sense. So light is light. It's just whether it's laser, LED, at the end of the day, you can have the same effect.
Yeah, and again, it's, nanometers, you can't just stand out in the sun, for 24 hours and think that you're going to be a better athlete. No.
I'll feel better.
Exactly, so would I. But yeah, so again, it's, and also with the lasers, they're, very more, they're very more focused. She's like, no, I'm not getting it. They're focused, so you would have to treat multiple areas on a large amount of the big muscles in order to get the same kind of treatment area that you're getting with a pad.
That makes sense. All right, next question. Oh, this is good. This is good. As I was just holding it and it's turned on, and I'm kind of waving
Shining
it all over the place.
Eyes,
What concerns, safety precautions should I take?
So
I think safety is so important.
Right, it is. There's many of classes of lasers out there, but at 600 milliwatts, it's safe for at-home use. You don't need to put goggles on your dog. You don't need to wear sunglasses. You don't have to wear protective eyewear.
You're back in the sun again.
Yeah, where you would have to do that in the hospital when your dog's getting treated by a therapeutic laser. But the same thing is that there's energy and there's light coming out of that, so you don't want to shine it directly into your eyes. You don't want to shine it directly into their eyes. So it's that common sense there, but the great thing is that you don't have to wear the goggles. So one of the questions out there was, can you use it on cancer, or if your dog has had cancer, can you use it safely? And so what we recommend is that if your dog had a mass removed or what was known as cancer, say, this spot right here was, say, a mast cell tumor and it was taken away, what we recommend is not to place it over that area. But in my experience, I have used light therapy on patients that have had masses removed, and I've used it other areas. So the rest of the muscles groups, and I have not had reoccurrence of that. And so again, from my experience, that's what we would recommend. If you think your dog may have cancer, well, then you go to your veterinarian.
And you make sure. Common sense.
You make sure that you get that medicine diagnosed first and worked out. Also, there was a question about using it on black dogs.
And that was because light absorption, right? With different pigments,
and that comes mostly from the focused type of light from lasers, because that can heat up dogs that have black skin or black fur coats. This does not do that because, again, it's not the focused type of light, so it can be used very comfortably. I always say, this is energy being put into the body. I feel it. I'm very sensitive to energy, and so you listen to your dog. They should like this. It's a little bit of a warming type of sensation.
But you can't burn. They're not going to burn them.
They're not going to burn them. It's very, very safe. But still listen to your dog. If it's something where they're just like, I do not enjoy this, well then kind of, assess the environment and try to figure out, because
Okay.
this should be soothing to them and they should be enjoying it.
Okay, so it's safe. Perfect. All right, you mentioned this comes from human medicine. What is the difference in human models and the canine models?
Yeah, so the research is really hot now in human medicine, so that's where we're kind of pulling a lot of that translational medicine from. But basically, right now, there's no human model of that pad. Where it's being used is in.
You mean canine model?
No, there's no human model.
Oh,
There's
really?
a canine model. It's in your hand.
Right.
So
I was thinking model based on study design. Okay.
Right, exactly.
I got
We
you.
have not.
I got
We
you.
don't have studies done on canine.
Right,
It's something that
right.
we want to
We
do.
need to do.
Yep, absolutely. But right now, for humans, it's being used mostly in the sporting field. So there,
Right.
a lot of the big like NFL and stuff like that.
Right.
They have products that they can use, but there's not something that you, as a human, could go out and buy on Amazon
Okay, all right.
and get. So right now.
So
it's-
right now, unless you're an athlete on the human side, you're not getting this. And I know when I did some digging, a lot of the professional baseball pitchers, they're using this especially for their rotator cuffs. So they're actually applying this prior to going out and pitching, and then as soon as they come back into the dugout, they're hitting their shoulders again. So we're really fortunate. So if you and I just can't order one of these because we're not really athletes, in my mind I'm an athlete, but if we're not, but now it's available for the canines first. So that's, talk about translational medicine or translational
Great.
effect, straight from the human athlete to the canine athlete. This is great. So you mentioned this should be used on muscle groups, but can I use it anywhere else?
So when we're focusing on preconditioning or conditioning, we want to use it on the big muscle groups like the hamstrings and the quadriceps and the paraspinal muscles, the triceps, the supraspinatus, areas like that we know that they're going to be using a lot during their competition. People have asked me, can you use it over a joint or things like that? Well, it increases blood flow and it decreases inflammation and removes those waste product removal. So you can use it in different areas. But if we're looking at our conditioning and recovery, we want to use it in those big muscle groups that are being used during the activity.
So, and knowing that it's malleable. I mean, so if you had a carpal issue, so if you have a dog, I mean, a lot of these dogs that are doing, say, fly ball or agility, and they're having repetitive activity to their carpus, can they, or geriatrics? Yeah, that's a good point. So we know they have.
Again, it's maintenance. It's to take that older carpus, that used to perform just perfectly when it was younger, and give it a little bit of energy, so that way it can, perform the best it can. So again, it's not a treatment for a carpal injury. It's not a treatment, for OA. It's just basically trying to make these tissues the best that they can make.
So maintenance. Yeah. It's maintenance. All right. That's a good question as well. This was an SOS. So someone has the pad. They were using it, and this was a really fascinating question. I had really no idea. I learned a lot from this one. So we used our pad yesterday and did not see a red glow, but the green light's on. Was it working? So how do we? So this is. So walk us through this, because I played with that, and it's actually quite fascinating.
So this nanometer of light range is infrared. So it's really, to most people, you cannot see it with the naked eye. Some people can. So it really depends on what people can pick up. But so if the light is flashing, it is emitting. The neat way to do it, if you have an older iPhone camera or Android, if you actually look at the nubbins or the light pipes, yes, you can actually, through your camera, you can see the red glow. Now, with the newer models, a lot of our cameras nowadays have infrared filters. And so if you cannot see the red glow with your camera, looking, holding your camera and looking at the nubbins, then you would actually put selfie mode on. I'm
really good at selfies.
Yes, you are.
So I should be able to be a pro at seeing the red glow
we're
through the light pipe.
We're going to see Sherman and the EdgeLight pad
we're going to be seeing lots of pad selfies.
But yeah, so then you could see the glow that way.
And in fact, for all my patients, all my canine athletes that I work with, when you have these, please bring them in and we'll selfie together. There we go. All right, next question. All right. Have you tried the EdgeLight with a lot of clients, and can you share any of the results of the before and afters, say for agility, fly ball, etc.?
Yeah, so I mean, the trials for safety and efficacy have been done. Well, effectiveness. But we have not done, because this is new, so we haven't done any trials. It's something we want to do. And again, we want feedback from everybody using this on differences that they're seeing. And that would be, you know, great data and knowledge so we can pass it along. But this is new. This what came out, what, a couple weeks ago?
No, this just launched. Hence the reason we're doing this. Hence the reason we're answering your questions. Because again, we had some of the same questions. I think it's about translational medicine, and we really believe in taking things from humans to animals and animals to humans. And the data is really strong on the human side, and that's the way it's been with a lot of things. Think regenerative medicine and some of the other technologies and procedures we use from humans to canines. This really shouldn't be any different.
Exactly. And again, we have to do the studies, absolutely. But it's such great treatment and modality to come out. Like, we don't want to hold that back. And again, we're going to use the translational platform to be able to, you know, give it to our dogs and our athletes and see what it can do
that
for
makes
them.
sense. Next question. Now that we've addressed the question, oh, here we go. This is where it's going to get interesting because she's in a coma right now.
There we go. We have to wake her up.
But we're going to go ahead and we'll pause this for 1 second, and then we're going to go ahead and wake up Egret and show you guys. I think it probably will do the most common areas. You know, definitely the shoulder, definitely the ilio, the QLs, hamstrings, quads, places that we want you to be comfortable applying this to your canine companion or canine athlete at home. So let's go ahead and see if we can wake her up and do some demonstrations.
Great.
Hi, I'm Dr. Sherman Canapp.
I'm Dr. Debra Canapp.
With the Veterinary Orthopedic and Sports Medicine Group, or VOSM, and we're going to be doing a demonstration on the new EdgeLight light device, the light pad for canines, for canine athletes and canine companions. This just launched, and we're so excited. It came from a human platform for human athletes, and we're going to do a demonstration on Egret of how to actually apply it and how to use it. So it comes in this nice little carrying case, and we reach inside, and these are the actual light pads themselves. We used to call these nubbins. We actually found out that they're actually light pipes. Has a little Velcro type kind of covering, if you would. You'll see how it actually, the Velcro straps go around to hold it in place, so that you don't just have to sit there and hold it on your canine. You could, and we'll do a demonstration on that as well. In there as well, in this little pouch, is the charging device. It's actually battery powered, and it's very, very simple. Just like charging your phone, you're just going to plug this into an outlet, and then plug this directly into the device. And the power, there's a very simple power button right here that you hold down, and the little LEDs will light up so that you know the device is on. And that also tells you the power and the settings. Then we'll go through that also. Battery life, and then also the settings that you're on as far as the time, I believe, as well, right? So let's go ahead and this is Egret, our demo dog, and she has offered to demonstrate the use of the EdgeLight light pad for the different areas. So what we wanted to do is, you know, in canine companions and especially in athletes, there's certain areas on the body, and this is all about preconditioning and recovery. You know, we're talking about trying to apply this to areas that we know are areas of many times tension, areas that can have injury, and we're looking at ways that we can try to warm those tissues up. This is part of the warm-up session or the cool-down as well. And so let's look at some of the most common areas and how you actually fasten this to the body.
And so what comes with the product also is this lovely, Velcro strap and some little additional things which we'll show. The nice thing about this Velcro strap is that it has a surface that's a little bit rubbery on the one side, and then the kind of soft side of the Velcro on the other. This side goes against the dog, so it actually stops slipping. So I'll show that how it goes.
That makes sense. So I think for starters, the shoulder. You know, with most of my patients from around the planet doing any types of sports, we know the shoulder is probably the most common area of tension, of injury, of concern. So let's go ahead and show some various shoulder techniques. Okay.
So
she's trying to get away from you, just so you know. She's never this close to me. This is probably painful to her. All right.
She's leaving now.
All right. Let's go ahead and show.
So basically, there's no set way to actually put this on your dog, and so you have to have a little bit of creativity. So if you asked me to do it twice, I probably would do it different twice, but we're going to kind of go over. So first I just kind of apply it, so I have my strap attached to my pad. You would go ahead and start it, and then basically what you're going to be doing here is trying to keep it in place, so that way if your dog is standing, and I'm going to undo my Velcro here, there we go. And so if I'm going to place it here, then I'm probably going to want to come between her legs here, up and over here. And then we could, end up sticking kind of right there.
Okay,
so
that makes sense.
That can hold there.
And that'll stay in place.
Right, that's
Okay.
going to stay in place. Now, if she went outside to run, no, it's not going to stay in
Got
place. If she was laying down, that would probably be fine. If she was sitting, sit. Still correctly over her shoulder, which is really nice. So again, it's something where, could I tie it and come, between her legs this way and tie it? Absolutely.
Okay.
So there's lots of different ways, but the idea is that so that way you don't have to stand here and hold it the whole entire time.
Right.
You can have a way to fasten the device to your patient or pet and keep it there.
So my thoughts then, if we're using this for preconditioning, for instance, we haven't gone out yet for our training session or for competition, is that you're going to apply this and then essentially your canine can go into their X pen, into their crate or their kennel.
Yeah.
What about, this is kind of crazy, but what about you're on your way? We know we're placing this on in advance, right? So you're heading to your training facility, or you may be training in your backyard, or you're driving somewhere. Yeah. Could you apply this? And they're in the crate in the car, or just sitting next to you on the seat. Is that
I'm smiling, right? So it's if you trust your dog, right?
Oh,
so
point.
These are not inexpensive. I think they're very well priced.
They could eat it.
So you want to make sure that if you trust your dog and you put it on them, that it's still going to be there when you take them out of the crate. So otherwise, yes, you can.
Point
absolutely,
well taken.
Absolutely.
Right.
But
so safer would be in your
while you're watching
having your eyes on them.
Yeah, we don't want them to ingest this. I don't think any safety studies have been done with that. But so again, we want to avoid taking our investment.
So do you think there's a way, because again, they have two shoulders, you know, and we're talking about bilateral, they turn left, they turn right, so we're trying to really have this as a preconditioning device for both shoulders. So could they have one here? Could they have a pad on that side as well?
If you had two pads and you were, basically
just crisscross
and put them both in.
Okay.
Absolutely.
All right, that makes sense.
Absolutely. Same thing with your paraspinals. So really important in dogs that may be a little bit.
Right.
Which way do you want to go?
Whichever way she wants to go.
All right. She's like, no.
I
know.
All right, baby.
There we go.
There we go.
All right, so basically this is an area, the paraspinal muscles is that an area you really want to treat for predisposed dogs for iliopsoas strain. Yeah. So if we warm up this area and get it very flexible and have this function as best we can, then the insertion of that is going to be a lot better off than if we have a tightened paramuscle area.
Right. And core is so important.
Yes, absolutely.
Warming up the core is so. I mean, any sport or any activity, same for us, core is absolutely one of the most important aspects.
Yeah. And the big thing here is that their abdomen's underneath here, so you want to avoid placing it on the abdomen.
Okay.
We don't want to treat the internal organs. We want to treat the muscles. Okay. So basically, here's her spine right here, and this really nice muscle mass. This is her paraspinals.
And if there's any questions, we know the psoas starts behind the 13th rib. So if you just palpate your dog or pet, it falls right into this little groove here, right when it falls off the rib. That's where we would start.
Yeah, exactly. Okay. And here, I mean, it's really simple. Now, if you had another one over here, you could put two at the same time.
Okay.
But basically, you're coming here. Now, what's nice is that you have this lovely little wrap thing here. If you didn't want to go around it a whole bunch of times, and say you had a smaller dog, or you just wanted to go around it once because you have a really good dog, you can use these extra little securing patches and just kind of go like this.
Perfect. And if we had a second one, you would envision we're going to slide this right underneath on the same side.
Yeah.
Okay.
And again, so it's a 20-minute duration. Could I put this too tight and cause, decreased circulation? I could. So really, you're going to get
probably
used to
finger.
it.
You should easily be able to get your fingers in there, I think, so that we know it's like a bandage.
Yeah.
We want to make sure it's not too snug. Yeah. And I think EdgeLight is going to have pictures and models of dogs and diagrams to really kind of allow you to understand the anatomy and where you're placing these for the various different conditions, for the various different types of areas that we want to warm up or cool down for preconditioning and recovery. All right. So what about the back leg? Let's talk about the hamstrings or the quads.
Yeah. So basically, you have two major muscle groups here. So you would either be securing it to the back. Or to the front area there.
Okay.
And again, the way you're going to basically do this is kind of in a zigzag pattern. What I like to do sometimes is incorporate the bottom of my pad down here.
Okay. So it doesn't slide.
Yep, you got it. And then I'm just going to basically come up here. And I'm telling you, I will do this differently every time I put it on.
So I have a question. Would you have already activated this, turned it on? Because it's going to be hard then to get in there. So I think at home, make sure that you push the button first. Because again, you're going to have this covered up, and then you'll be like, where's the on switch? So and that way you can also see the lights. So
Yeah.
Perfect.
So again, I mean, I can guarantee you I would put it on different every single time, but the biggest components is that you want to have some support underneath so it doesn't
Okay.
slip,
Right.
and then you have the pressure on it so it's actually against the tissues.
Okay.
So, those are the
So if
big
there was an area of
components.
tension, say this left psoas was really a challenge, and they're working with their rehab therapist, they've been staying on top of this, they've been doing appropriate massages and stretches, but we just know that that's a chronic psoas that they've been dealing with forever. It's okay if they just hold it there as well. They don't have
Absolutely,
to necessarily have this device on. They can just
If
kind of
you
hold it in
are
place.
sitting at night and watching TV and just relaxing with your dog, and they're sitting on the couch with you, you can hold this anywhere you need to.
Okay, so you don't
can
always have to use the
hold
Velcro
it here
strap.
or here. Yep, you can
Okay.
just sit there and just hang out.
Got it. That makes sense. And Enzo's going to demonstrate the use of the EdgeLight light pad that we use for preconditioning and post-recovery while we're just lying on our bed. Okay, so we're not going to use the straps. We have a demonstration of Egrid standing with the straps in place, but your dog may choose to lie down on the dog bed, and your dog may choose to lie down on the couch or just lie in between sessions, in between training sessions or competition. So you don't have to use the Velcro straps all the time. You can just actually hold this in place. The other thing I want to demonstrate is that we have these things called, Deb calls them nubbins. I think they're really called
Light pipes.
light pipes, and this was the modification from taking this for human athletes to our canine athletes or canine companions that are active. And what that is these little light pipes will actually work their way down into the fur, okay? And that's important, so we actually have contact, direct contact to the surface area that we're doing the treatment for. So if we watch what we're going to do, we have the device turned on, and Enzo's just lying here, and we'll show you where we would normally go for the shoulder, which is one thing, and
So I
especially
have
in
the
border
quads.
collies.
So you can see the quads right
You can
there.
see the quads right there. Enzo now chooses to stand
I
up.
know. Now
We'll
you
lie him
can
back
stand
down,
up.
but I'll show you a few different areas. We'll look at the shoulder, we'll look at the psoas, and then we'll look at the quads or the hamstrings as well. These are areas that in our active dogs that we want to make sure that we're staying on top of. So let's go ahead.
Right here.
You want to sit up like
Yeah.
this? Okay. So
That's great.
again, nice furry coat. We
Right
have
down.
our little nubbins, if you
Good
would.
boy.
So we're just going to lie on our side, so we know where the shoulder is. And again, if there's any questions about anatomy, there's some really good descriptions and pictures and areas that you can find on the EdgeLight website. And so we know that the shoulder, remember this is going to be the carpus or the wrist, the elbow, the shoulder's right here. So when this comes up to the shoulder, the muscles, supraspinatus, infraspinatus, they run in this plane, okay? So what you're going to do is just take your device and just hold it over that area, okay? And so,
Oh, you have to nestle it in.
oh, we're nestling, sorry,
Yes,
I didn't
the
nestle.
nestle.
The whole light pipes,
Pipes.
light pipes,
okay. Light
nubbins
pipes, yes.
are to, so we're going to actually, is this what we do? We kind of massage it in?
So,
Demonstrate for me.
so basically, here's his hair coat. So what we want to do is kind of nestle it in there, so that way it's on direct contact with the skin.
Okay.
So just a little bit of
buddy.
nestling. Do you like nestling? Yeah,
There
is
we
that
go.
it?
There we
yeah.
go.
So basically, just a little bit of nestling in there, and that way it's actually contacting the skin through the hair.
Okay.
If you just kind of place it on, it's better than if you would just place one on without light pipes. But if you kind of nestle it in a little bit there, you kind of get that hair out of the way.
And again, every dog's different. Some dogs like
Not
to
over
be
there.
in ladder or be lying down. Other
Yeah,
dogs
good
like to be
job.
standing.
Good job.
Some dogs you'll want to go ahead and use the actual straps on. Other dogs you may want to just go ahead and hold in place. And it really depends on your canine, on your athlete, and you'll know them best. And sometimes it's just trial and error. You won't really know until you start applying it. I know, hello, how are you? Thank you very much. So when you go ahead and try this, if there's questions about anatomy and where to place it, please feel free to go to the website. There's videos, there's nice descriptions, and different types of sort of cartoon figures that you can see as to where those would go. And then just try different techniques as far as whether you're going to hold it in place. But like Deb said, make sure you take advantage of the light post and kind of nestle that in between the fur down to the level of the skin. Thank you, Enzo.
Great. Thank you. Good boy.
So Deb, this is the EdgeLight light pad. We have the Velcro sort of cover on there. That way the straps can actually attach to the device and then attach to the body. Definitely recommend turning the device on prior to application, prior to placing it on the body. So this is where the USB would be. So we're gonna charge here, and this is the on-off switch.
Yes.
So essentially, we're just gonna hold this down. And you're going to see a light come up, and I believe you hold it, you keep it down until you see all the lights come on, if I'm correct. There we go. So it's
where
counting down.
it's switching here, so it's not counting down, it's actually choosing your 3 different settings.
Oh, so walk me through that.
Yeah.
So I'm just holding this down. I can release now.
Exactly, release.
Okay.
So that is your 20-minute setting. So the light that is illuminated closest to the power on button should be the 20-minute setting.
Oh, so down here towards this button, it's 20 minutes,
Yep.
and then if it's one up and one up from that,
Yeah,
it's going
so
to be
10 minute and 5.
And 5. Okay. So what's this flashing? What does that tell me?
Right, so that tells you it's operating. So you're actually treating your hand right now.
Treating my hand right, and
There you
that's
go.
safe. That's
Yep,
okay.
that's absolutely
Excellent.
fine.
It's feeling better already.
There you go.
And so, what about battery power? What am I going to see as my battery, as I'm using this on my canine athlete throughout the day, or many patients or canine athletes? What happens as this battery runs down? What will I look for?
It basically, as it's flashing like that, you would have less of those little green lights flashing if your battery was
Okay, so instead of all 4 being lit
Yep.
up, it may be 3, then it may be 2. And I think it's important, just like a cell phone,
Yes.
from what I understand, is to let that battery go down.
Yes.
It's going to help with recharging and lifetime of the battery. Is
Correct.
that right?
Correct.
Okay, perfect. What about turning it off? I just hold it down again, or?
Yes.
Okay, let's try this.
No, you have to hold it down longer.
Hold it down longer.
Yeah. Keep holding it.
Wow.
Keep holding. Keep holding. There you go.
It's off. And then we'll just put it back in its little pouch.
There you go.
Actually,
Yeah.
it had plenty of charge, so I'm not going to plug it back in to charge it. We'll
Correct.
just wait for it to run
Yeah.
down.
Yeah. So if you set it for 20 minutes, right? So that's going to, when you turn it on, it's going to be the light closest to your power button.
Right, that makes sense.
That is where it's going to stay every time. So that's my
So we're going to have
understanding.
to set it again.
That's my
Oh, that's
understanding.
great.
And so
Okay.
when you start up your device, you would follow the directions that it comes with, which is just holding down that button for 2 seconds to start up your device.
Okay,
And that
perfect.
should be on the setting that it was previously set at.
Okay, and these directions are all on the website as well, in case
are.
there's questions.
Yes.
Perfect. Thank you. So once again, these are available now. They just launched to the canine world for our canine companions as well as athletes. You can go to the website that will be listed here. And again, if you order, 10% discount if you put the Canapp code in, which is Canapp 10. And again, we were really pushing to bring this to the veterinary sector, and they've allowed us to do this. So we're so excited.